Now, well, I understand, Diann, you're a nurse, right?
That's correct. Yes.
So what
I'm a
made you,
registered.
okay, registered nurse, what made you decide to go ahead and get into coding?
Actually, my employer, is encouraging all the staff to become certified in coding. And Alicia, I believe it was you that had mentioned the magic HCC, which the hierarchal condition categories, because part of my role is, while I did do 10 years of clinical work, I'm an educator for physician practices, and the key here is to try to help them to, show through coding and documentation how sick their patients are or how complex they are. And what I do is I serve as like an educator to kind of encourage them to be more specific in how they document to make it easier for the coders. So you don't have to kind of hound them down and try to get that information.
Yes, I think that tends to be one of the banes of physicians and coders is that the coder realizes the work or what needs to be coded or can be coded, but there just isn't enough documentation to have that to get to the most precise code. I think Laureen's putting up your letter real quick on the screen. And what do you think about the blitz that helped you pass? Because obviously you have the medical background. The terminology probably was easier for you than for most people. But what now? And real quick, the experience that I've had with nurses is that they don't like coding because they were forced to deal with coding and they weren't properly trained, and so they just try to avoid it, which it's really an integral part of their job, more so now than it was before. But what do you think about the blitz that assisted you the most?
Oh, golly, there's so many aspects of it. I mean, it was just overall really well organized. And I just think for me, the little pointers you had to learn E&M, coding, because I was just perplexed. I couldn't figure that out to save my soul. But your little tips and tricks on the E&M piece, that was magnificent. And then, the highlighting and bubbling. Oh, thank you. Because when you're taking that exam, the time is just really tight. And, I will be honest with everyone. I didn't finish it. There was probably about 10 questions left. And I mean, for me, I would, and this is also on the AAPC website, but I would highly recommend getting your confidence up and just flipping through the book and going to the sections that you're strongest. And you're absolutely right. The very first place I went was the anatomy and physiology terminology to get those questions and to feel really good about, getting into the exam. But yeah, the time is really tight. And so all of your tips and tricks were extremely helpful.
That's really good. And that's, coming from a person that, again, has a medical background, it doesn't matter if we have a lot of people that don't have a medical background, but they know that's what they want to do. They want to get involved in coding. And so it's not like you have to have that to succeed. It helps anybody, I think, is helpful to know.
Oh, absolutely. Yeah, definitely. I mean, and even if the medical terminology isn't your strong suit, yeah, there's a lot to learn. And to your point about, clinicians not kind of know, when you go to medical school, or in my case, when I was in nursing school, we were trained in theory, but unfortunately, like I look at the ICD-9 book as kind of like a dictionary.
Right.
And unfortunately, I think we were not trained to use the terminology in the ICD-9 book that mirrors what we perform. And
Right.
it's yeah, it's going to be a long road with ICD-10 coming. So.
Nope, it's going to be great. Trust me, it's going to be
Yeah.
wonderful. And we'll have stuff on ICD-10 soon. Laureen and I are going to give you some information about that. One thing before I let you go, you mentioned the E&M, and as a physician educator, E&M is what they're being reimbursed on. And so it's so important that you, as the coder and as working as an educator, are able to tell that information to the physician so that they understand it, so they can give you the documentation they need so that they can be reimbursed for what they're doing. And ultimately, it's all about patient care. That gives the patient better care overall. So and being a nurse, you know exactly what that means, you know, how important the patient care is. That's a nurse's job, and the doctor's job first is patient care, and the money is falls second most of the time, or should, right?
Absolutely, absolutely.
Well, we really appreciate you being on here, Diann. And is this the first webinar you've gotten to attend?
This is my second.
Okay, good, good. So I'm sure you'll be able to come many more times and visit with us, and we may even pick your brain as a physician educator in the future.
Yes.
Oh, most definitely. Hey, certainly. Least I could do for helping pass the exam.
There you go.
And come join us on the discussion board, our forum. codingcertification.org/forum. It is really growing and getting a lot of good people there helping each other, and it's just very warm and friendly. I'm very proud of it. So I'd love to see some posts there from you too. That'd be great.
Excellent.
Thank you, Diann.
I'll do that.
Thanks, Diann.
Thank you.
Get more CPC exam tips, coding certification training, and CEU credits. Go to www.codingcertification.org.